pursue treatment elsewhere, just so that you can get your life back.
They need to find themselves a new doctor that believes in Lyme and can treat them and try to help them, especially if it's Lyme symptoms.
Nothing's wrong with you. You're sick. They just don't know what they're doing. The doctors don't know what they're doing, and hang in there and find the right doctor.
I would tell them to read about Lyme disease first, and then I would tell them to find a doctor that understands Lyme disease and let him do a clinical observation.
I would tell them to find a good Lyme literate doctor and at least be evaluated, you know. It's crazy to go through after doctor after doctor after doctor and just be told that you're crazy. Just find a Lyme doctor and get tested, you know, at least find out for sure, and, you know, get treated if you can.
I would tell them to get tested for Lyme and continue seeing doctors until they find out that it most likely is Lyme disease.
Well, I would say Lyme is a great masquerader. I would say it manifests itself differently in every person. I would say don't believe the test results, because a negative test doesn't mean you don't have it. And persevere to get an answer, and don't rule out Lyme, because it's very real and you don't want to mess with it.
I would advise them to try and seek a Lyme literate doctor.
You have to be your own doctor. You're not crazy, and there has to be someone out there that will listen to you eventually. Just don't give up.
So please go see a Lyme literate medical doctor.
Well, I would sigh, and I would tell them that it's going to be a long road. I would tell them it sounds like they have symptoms of Lyme disease, and I would direct them to the resources that I know of. And actually, I don't really have a doctor that I would solely recommend, but I would definitely point them to resources so that they can educate themselves and find the healer or doctor or assistance that they'll need.
I would tell them that they should be tested for Lyme disease and that antibodies against Lyme peak between 4 and 6 weeks. And so if you're being tested before or after this time, that you should really look into a clinical diagnosis and seeing a doctor that's literate in Lyme disease.
Lyme tests are not accurate, and if you feel you're not getting treated and you're still ill, do not ever give up. There is hope.
I would tell them to go see my doctor.
Trust your gut and don't give up. If you know there's something wrong with you, don't give up until you get an answer that seems right. It took me 29 years, but in my first 2-hour appointment with my doctor, he was able to explain every symptom that I had for 29 years with one diagnosis. And over the past 2.5 years, as I've gotten better, those symptoms are disappearing as well.
I would say keep pushing, keep questioning, and find a Lyme literate doctor who's going to help you.
I would say go to an LLMD. Get onto the Facebook chat and talk to people. Go to the Lyme websites and find out who the best doctors are in their area, and do not waste your time any longer.
I would say the doctors aren't testing properly for Lyme disease. I got tested twice for Lyme disease and it came back negative both times. And what they don't tell you is that test is only 40% accurate, and there are other tests that are much more accurate, and you're probably better off seeing a Lyme specialist to get these special tests. The testing that your primary doctors are using was never meant to diagnose Lyme disease. It was pretty much for the CDC to keep a track of how prevalent the disease is and not to diagnose patients. And all the doctors are using that as a diagnostic tool when it was never intended for that.
I would lead them to an LLMD and help them find an LLMD in their area so they can be diagnosed by someone who is familiar with Lyme. I would educate them about the inaccuracy of testing and why the medical establishment isn't very supportive of Lyme disease.
Get tested through IGeneX Labs, because I came up negative on the ELISA test in November of '09, and in December of '09 I was positive through IGeneX for Lyme, Babesia, and Bartonella.